All right, good day and welcome to my channel once again. The topic before us today says everything about NHIS in Nigeria. Everything about NHIS in Nigeria. There's NHIS in Ghana, but our discussion is about Nigeria. So now, what is NHIS? But before we continue talking about NHIS, I would like to appeal to us to please, if you have not subscribed to this channel, please do well to subscribe to this channel and help us to grow. Now, back to the topic at hand. What is NHIS? Now, NHIS is simply an health insurance scheme that is organized by the federal government of Nigeria, which gives you free access, to health care in any participating hospital just for a token paid annually. Take note of the words participating hospital. Gives you free access to health care in any participating hospital, and you only need to pay a little amount annually. It's not every hospital that's registered under NHIS. It is not every hospital you go to that will honor your NHIS membership, say you do or eventually get enrolled in the scheme. But then in this video, I will also show you, I will show us how we can recognize the hospitals that are registered under NHIS. In fact, on the website, a list of NHIS participating hospitals are there, and I will take us to that place so that we'll see it for ourselves. Now, the question that arises again is NHIS only for government workers? Because there is a preconceived notion, or let me say misinformation around NHIS. Most persons feel that, this health insurance scheme is just for government workers, but it's not true. The reason because is that there are many programs under NHIS. Many programs. One of them is the Public Sector Social Health Insurance Program, which is number one you see here, PSHIP. That is the Public Sector Social Health Insurance Program, and that one is for government workers. That is the popular one that everybody know about. So everybody say it's just for government workers. That's just one of the programs. Now we come over to the number 2 here that says GIFSHIP, Give Ship. This one is the one that covers for every other person that's not a government worker. So you get it now. So Give Ship is for every other person who is not a government worker. You are self-employed, you are employed in a private firm, and maybe that firm does not have the capacity to do because there are some companies that can register NHIS for their employees, health insurance for their employees, but there are some companies who do not do that. So as such, you have responsibility to go register NHIS for yourself. And we are saying that the money you have to pay is not much, and it will not be difficult for you to afford for you and your loved ones or your family. So that's Give Ship for every other person who is not a government worker. Now there's also Give Ship means Group, Individual and Family Social Health Insurance Program. Now over to OPSHIP, which is Upship. This one means Organized Private Sector Social Health Insurance Program. So you work in a private company and they have capacity to organize health insurance. So those companies, private companies, can register under upship for their employees. So get that now. Now the last one there is T-ship. T-ship is tertiary institutions social health insurance program. This one is for students who are in tertiary. I'll speak any English now. Tertiary institutions, you know, from College of Education to, polytechnic to universities. This is the one that covers for them. It's very easy to register under. But our discussion for this video will be solely based on GIFSHIP, which is the Group Individual and Family Social Health Insurance Program, and maybe one or two about the Tertiary Institution Social Health Insurance Program. In fact, let me even deal with Tertiary Institutions uh, uh, Social Health Insurance Program, because that one is very, it just is minute. All you just need to do is go to the health center of your institution. Say you attend Uniben, you attend Unilag, go to the health center there and ask for NHIS, and they will register you there. The fee for it is just 2,000 naira annually. 2,000 naira every session. That's what we pay under NHIS. So if you are a tertiary institution student and you are interested in NHIS, you can quickly go and register with your school's health center. 2,000 naira annually. They will give you your membership card, NHIA number and what have you, and then you'll be registered under the scheme, and you can go on to enjoy the benefits of NHIS, of which we will soon be talking about the benefits of NHIS. Now, let's go over to the benefits. What are the benefits of NHIS? I've listed some of them here. This list is not exhaustive. There are medical conditions, medical services, that we don't know of, so long you are not a medical practitioner. But these are the common ones that are available. So now number one is free registration at your choice hospital. Remember I said there are participating hospitals. Not every hospital is participating in NHIS. And now when you register for NHIS, you have right to make a choice of the hospital that you want. NHIS will not just give you any hospital they like. It is you who will choose the one you like. Maybe the one near you, or the one who you feel can offer you good services. So any one of your choice you can choose during enrollment. And when you go to that hospital, when you show them your NHIA membership card, they will register you for free with no charges attached. Now also kidney dialysis, but this one is limited. So kidney dialysis, I think, is like up to 6 sessions you can have yearly. 6 sessions. Anything beyond that, now you go pay by yourself. Now, pregnancy also, but this one is also limited number. It's not limited as per the services that can be rendered to you when you are pregnant, but it is limited as to the number of pregnancy you can do under NHIS. It's 4 pregnancies. So if you go to get belle, anyhow, they born 6 children, born full community. After 4, now you go use your head carry the remaining ones. So 4 pregnancies, that's what NHIS will cover for you. And I think that is very, very fair. Now, under pregnancy, can go on from antenatal, everything concerning, maternity stuff, concerning pregnancy. from start to finish till you put to bed. Put to bed or put to bed, whichever English is correct, but you shall know what I'm talking about. Even when you give birth through CS, cesarean section, NHIS will also cover for it. Now also dental care, anything concerning your teeth. Now also annual checkup. You go for checkup at the hospital, but they do you one kind. You say, let me go and see what is wrong with me. When you go to the hospital carrying your NHIS membership card, they will do checkup for you, test, scan, x-rays, all for free, just because of the token you are paying annually. There's also eye care. There's also free referral to specialists. Say you get to your hospital and what is wrong with you cannot be handled by them, they can refer you to a specialist hospital. Say UBTH, Luz, and the rest of them, and you go there for free under NHIS. Now also free drugs, but this one prescribed drugs, so not just any drug. You say you want to buy drug, you just go. It has to be prescribed for you. So once the doctor prescribes a drug for you, you go to the NHIS pharmacy and then you get your drugs there. But you pay 10% of the cost. 10% of the cost. That's what you pay. Like you're paying tithe. So now surgery. Not every kind of surgery, but at least good amount of surgery are covered by NHIS, major or intermediate or whatever minor surgeries are covered, but not all though. So now also 50% cover for MRI or CT scan. I think this one is women that does this one. 50% cover, they will only cover 50% of the cost for you, but you pay the other 50%, etc. Many others that can be available to you, under NHIS. Now, next subheading is the fees and cost of enrolling in NHIS. How much is required of you? How much? But this part is is kind of tricky, but still, let's go on. On the website, it says under gift ship. Remember I said at the beginning that this tutorial will be centered on gift ship and T-ship. We've already finalized with T-ship because it's a very simple one, short. It does not have any stress to it. But gift ship has intricacies, and that's why we are focusing on gift ship. On the website, it says the amount is 22,000 naira. Which website? NHIA website, National Health Insurance Authority. Their website says it is 22,000 naira for each individual. A maximum of 4 for individual and 6 for family. So you are an individual, you want to register for NHIS, you will be the principal enrollee. Then you will also have dependents. Those 3 extra persons you want to add to you are your dependents. Also for family, it is a maximum of 6. You is the husband for sure, who will be the principal, and then your spouse, which is your wife, and then 4 children, 4 biological children. That is what is covered under NHIS. But now, if you want to add another person, say the number of people you want to register is beyond these numbers here, that's when you now add them up as extra dependents. But all the same, according to the website, all of them is 22,000. Whether you are doing according to the number, below the number, or beyond the number, it is still 22k for each person that will be registered under the program for gift ship. But then take note, like I said before, it will be tricky. Take note that the actual price might be slightly different from the stated amount on the website. Nigeria, now you dey stay. You're not a stranger here. You know how things work in the country. So you might have a price on the website, and meanwhile, the time that price was updated is like 3 years ago. They might have changed or increased or reviewed the price, but then it's not yet reflecting on the website. Na Nigeria you dey, you know, and I know. So you can get to the NHIS office near you and they tell you a different price. Why am I saying this? I've seen from people, from people's testimonies, giving they are giving a different price. They are quoting a different price that is slightly higher than what is on the website. And so I think that may be the case, that the price has been reviewed, because I think, from time to time they review the price. For example, now if you want to do correction of information, date of birth for your NIN, formerly it was 16,000. Now 16,000 something. Now it has increased to 20 something thousand. So review can happen like that. But then in Nigeria, before they go and you know update the information on the website, it will be a very long time. That is just one scenario. The other scenario may be that when you get to the office, you could fit buy mineral. you know if you ask me, you buy mineral. So all of that. Maybe they no go ask me you buy mineral, but the mineral money is inside the amount they will be calling for you. So put all of this consideration into place and prepare yourself, as you are going, so that you don't go there and meet shock. They say, it shock you? It shock you? You don't have to be shocked like electricity. So on the website, it says 22,000 naira, but add something as you are going, so that you will not meet a different thing there and you'll be destabilized. So that is for that. So now, the next point of discussion is the documents that are required for enrolling. What documents? You need all of this information so that you will not just go there and come back empty-handed. You just my idea and my motivation for this video is to prepare you so that you go prepared. When you go there, you just once and for all, you get it done and you get out from there. Simple and clear. No need for you to go back again, because the location of the NHIS office, we will discuss that in this video also. It's not something you want to be, shuttling, to and fro. So, but then, what are the documents required? You need your NIN, which is very compulsory, both for the principal enrollee and his or her dependents. You need your NIN. Now, a question that may want to arise from here is that, what if the people I want to enroll with me, who are my dependents, are what's it called? Minors who do not have NIN. What should I do? Well, I want to break the news to you that you can register anybody for NIN from age 0 upwards. You can register for NIN. Anybody who's below 16 years can register for NIN, but then they will not give you card. What they will give to that person will be NIN slip. That's what is stated in NIMC website too. So I'm not just saying my own thing. So actually, minors can register for NIN. So you register your minors for NIN and then you take it to NHIS for registration. Okay, now I think I forgot to mention one thing concerning the fees and cost of enrolling. Apart from this, the normal enrollment fee, there's also NHIA ID card. You also pay for NHIA ID card, which contains your NHIA number, and that is 1,500 naira as quoted on the website. So take note of that. 1,500 naira for NHIA ID card. And I think every person that you will be registering with you will pay for that 1,500 naira. So it will be for each. So everybody will have the NHIA number / ID card. It's 1,500 naira for each individual, for each enrollee. So now that is for that. And like I said, price might change a little bit, bank charges and what have you. So now, okay, I'm very sorry for all of these. There's also one thing that I failed to mention, and that is that the fees that you are paying, both the enrollment fee and the NHIE number stroke ID card, will be done via remitter. But then, please don't go and rush and pay by yourself before going to the NHIS office. My preference and my advice would be that you go there with your money, ask them, confirm the price from physical staff there, those in charge there, before you make your payment. Because you might go and rush and take this website price and pay on remitter, and you get there, they tell you that that's not the price. What will you do? That will be double wahala for the body. So please don't do that. Don't rush and pay by yourself, because before I'm saying this, I've gone to remitter myself and I've checked remitter. I was hoping that remitter will quote the price automatically, but no, remitter did not quote the price automatically, and that's a problem. So you will not be sure of what you are paying, and that might result to another issue again for you. So don't go and pay by yourself. Get to the NHIS office and let the people there tell you how much it is, so that it will be confirmed before you make your payment, or rather they will even make the payment for you however they want to do it. So take note of that. So now, back to the documents required for enrolling. We talked about the NIN. There's also birth certificate. You need your birth certificate and the birth certificate of your dependents, those who you are enrolling. Birth certificate or age declaration. Now, marriage certificate. This one will be for your spouse. If you are married, and then passport photographs for each of you, and then any other document that show proof of family ties. So take note of all of these. So any document you have that will be relevant, apart from these compulsory, these necessary required ones, carry them along with you, so that you don't go and be stressing yourself over there, paying for what you're not supposed to pay for again, and then or maybe having to come back because of one document that's missing. So take note of all of these. So now, okay, the next on the outline are the drawbacks of the NHIS and best way to take advantage of it. Please take note that the NHIS is not foolproof. Over the years, they are still improving on it. And so it will be wise not to put all your hopes inside the NHIS, because it has some drawbacks. What are those drawbacks? One of them is bottlenecks and bureaucratic processes. When you go to the hospital and you show them you submit your NHIA card, to them, that the service that you want should be considered under the NHIS. Sometimes it becomes an issue. They go back and forth, go to this office, go to that office, auto code, verification, and what have you. it can waste a lot of time. And if you are not patient enough, you might not want to continue with it. But then patience is key also. Yes, patience is key. But then know that there are bottlenecks and there are bureaucratic processes. Another thing again that is a disadvantage, is a drawback for the NHIS is shortage of supplies. Shortage of supplies. You might get there, for a drug that has been prescribed to you for you, and the NHIS pharmacy does not have the drug, or they say it has finished, they've not ordered for more, and the rest of that. So these are the drawbacks of the NHIS. So my advice for you is to not totally rely on the NHIS. Please don't totally rely on the NHIS. My second advice is for you to use NHIS for mainly major issues. Major issues. When I say major issues, it does not mean it must be surgery or one big, like cancer, kidney. This is what I mean by major issues. I said for health services that cost between 15,000 naira to 20,000 naira and above, you can decide to use the NHIS for that. But health services, little drugs that you can just go to the pharmacy and get 5,000, 10,000. You should not. But I don't think you should be disturbing yourself. Going through all of those bottlenecks and processes before you get what you want to go and do that. But when it comes to major issues, say the money for that issue is high, then you can take advantage of the NHIS. Yes, because in all of this, even with the drawbacks, NHIS is a lifesaver. And you never can tell when anybody amongst you or you yourself will have a big health issue. We are not praying for that actually, but then it is the reality. It happens, it occurs. Say you have such a big health issue, then the NHIS can come through for you. It has come through for many persons. Many persons have done delivery through cesarean section, and it was the NHIS. They didn't have to pay a dime for that. And so you see, the NHIS can save you in those occasions. But if you are like me, who does not like stress, for little issues, you just decide to foot the bill on your own and just go home. But when it comes to bigger issues, then you can use the NHIS, and it will benefit you very, very much. So now the next point of discussion is where to go. Yes, where do you go to enroll for NHIS? Where? So now the best place to go to enroll for NHIS is an office near you, an NHIS or NHIA office near you. If we use the word near you, it sounds funny, it sounds weird somehow, because the reason is because there's only one NHIS office in each state, and it's located in the state capital. So I don't think there's any office near you, except maybe you reside in the state capital. But if you are like me, who lives far away from the state capital, it's not actually near you, but the nearest though. So the nearest office of the NHIS is in the state capital. Each state have NHIS office located at the state capital, and the FCT also has one. Only Lagos State has two offices, one in Ikeja and the other one in Yaba. So now, how do you access the address? How do you get the address? Do you just go to Yaba? Do you just go to Ikeja or to Asaba or wherever? Where can you see the address? Now, I have a video that the link is already in the description of this video. where I have listed out all the addresses of the NHIS offices nationwide. So you can go to that link, click on it and watch that video, and you will see the address of the NHIS office in your own state. But say you don't want to watch my video, you want to do it yourself, you can go to the NHIA website, which is nhia.gov.ng, nhia.gov.ng. You go to the website, and then on the home page you tap on the menu button. Okay, let me give us a practical for that. So I put on my data, I go over to my Chrome browser. Over here, let me do rotation. So this is my browser. I go over to nhia.gov.ng, and then I tap on go, and then it opens up for me. This is the home page. The first page that opens up for you when you enter into a website is the home page. So now this button here, this 3-line button here, this one here is called the menu button. So I tap on it. It brings out a drop down list where I now tap on about. You can see about there, the second item there. Tap on this plus button. The plus button is what you will tap on. The plus button just at the end here beside the about option. So I tap on it. It brings out another drop down. Scroll up, and there you see zonal. You see what? When you scroll up, you see zonal and state offices. See it here, zonal and state offices. Zonal and state offices, that one there. So I tap on zonal. Let me remove this one from here. Seems it wants to disturb me. Zonal and state offices. So it loads up for me. So you see now, these are the addresses. So whichever state that you reside in, you can quickly follow these processes that I've just highlighted for you, and then you will see all the addresses on the NHIA website. So you can just simply come here, this search bar, and type in your state. When I type in my state, which is Delta, and I tap on go to search, so you see now it has brought out the office in Delta State for me, and it's only one search results. That will tell you that it is only one office that is in Delta State, and it's located in the state capital. But then when you look here, you see that the current office address is not showing. Current office address here is not showing. It is not populating, meaning maybe at the end of NHIA, on their own side, they omitted that information. But I already have that information in my video. How did I do it? I simply contacted the phone number here, and I asked the person, please, where is the address of the NHIA in Delta State? And he simply wrote it out for me. So maybe yours can be like this case, maybe not. But this is just a simple way by which you can get the address. So now let's go back to where we are coming from. So you either watch the video or you go to the website and follow the processes that I just highlighted for you. So now, which other thing again? Yes, an advice I have for you. Please take note that, okay, take note that before you go to any of the office of your choice, do well to call them, to call the number that is attached for confirmation of appointment. You don't want to go there and then you do not meet any qualified person to attend to you. It's a government office and you know what it entails. So then call the number first and say, please sir, I want to come to the NHIS office to enroll. Are you available, or is anybody available to attend to me? And then the person will give you an answer, or maybe the person will give you a particular date and time for you to come, so that you know that you have an appointment. You don't want to pay transport fare and time, go there and meet nobody to attend to you. It will be very, very disastrous and disappointing for you. Another advice I have, not for you but for the NHIS themselves, because these locations seem to be very far. Yes, in my opinion, they are far. How can NHIS just have one office in the whole of the state that you have to travel all the way down to the state capital to enroll for NHIS? It's not wise. I mean, there are local government areas, local government councils where NHIS office can be attached to. I mean, it does not take the local government councils to employ just one person to man the NHIS office. Whether it is just one table in one corner in the LGA office, there's just one person, can pay the person 80,000 naira and the person will be coming twice or three times a week, and so the information of the person will just be online on the NHIS website, and then anybody who is in that local government area can call that person and say, when and when are your opening hours? Because I want to enroll. And then the person goes there at a particular date. It's a win-win for everyone. Win-win for the person who is being employed because he's not working all through the week there. Win-win for those who want to enroll because the location is not far. Time spent is reduced. Money spent for transport is reduced. And it's also a win-win for the NHIS because all these years since 2004, they have been clamoring that they want increased, participation. Nigerians are not buying into the idea of the NHIS. And you want people to buy into the idea, and yet you have only one office in the whole state. It doesn't make it make sense. It does not make any sense. So if the NHIS can do that simple thing, I think people will buy into the idea because it becomes easier for them to access their offices. Yeah, since 2004, how many millions of people have registered? Contrast it. On the website, it says 16 million 800 and something thousand people have been registered since 2004. How many years now? In contrast with the total population, over 200 million people. Come on. So it's a win-win for everyone. And I think that the NHIS should take this into consideration. Attach an individual in every LGA. Liaise with the LGA boss to employ one person. It does not mean that the NHIS will be the one to do the employment. The LGA can employ the person on behalf of the NHIS and pay the person on behalf of the NHIS. What does it take them? 80,000 naira per month. And then the person just works 2-3 days. The person can go and do other jobs, for himself. Because to be fair, 80,000 naira is it's not really, But when there's that kind of time allowance for the person can, make do with all of that. So that is it, or that is that for that. Okay, going on. How to register NHIS online. Is there a provision for which you can register your NHIS online without going to the physical office near you, well, it is best to just go to an NHIS office near you to just register. Although there is a provision for application online on the website, on the NHIA website, but the way the application form is structured, I suspect that they will still call and ask you to, visit their office. The form, I think, is just a preliminary application. But let me show us the form so that we see for ourselves. So we go over to nhia.gov.ng on our Chrome browser. Go over to our Chrome browser and then we type in NA. So this is the NHIA website that has opened for us. All we need to do is to locate where we can see the programs that NHIS offers. Remember, we said on this video we are particularly concerned or interested in the gift ship. Gift ship, the one for every other person who is not a government worker. So now I tap on this menu button quickly without wasting our time. Sorry, on this menu button here, I tap on it. It brings out options for me. One of the options that it brings out is programs. You can see programs there, programs here. So I tap on the plus button just at the side of it. Remember, we are dealing with gift ship, and gift ship is under contributory. Under contributory is where gift ship is. So now I tap on it. It opens up for me the programs, the various programs that the NHIS offers, and then I scroll up. You can see the option here: group, individual and family social health insurance program. I tap on that. It opens up for me, what it's all about. If you want to read through, you can read through, and scroll down. When you get to this part, number 4 says get NHIA ID cards for everyone, but then where we are interested on is requirements to enroll into this program. Click here. That's to enroll, to view the requirements, but that's not our interest now. You can check that on your own. There is also another click here to enroll in gift ship. So that's the button, that's the one you will click on this part here. So that's the one we are interested in. So I click there. I tap on that part there. It opens up for me and brings up the form for me to fill, the application form. But just look at it. You see that there's nothing much here, nothing really much here. So it's just preliminary. So I can bet you that at the end of the day they will still call you, because after you have filled in this information, your NIN, the principal, which is yourself, who will be the lead enrollee, then others are dependent on you. So now that's where your name will be, your email, your phone number, your date of birth, the let's leave health maintenance organization, but then your healthcare provider, that's the hospital you intend to use. Remember I said you have to go to the website. Okay, I have not said that. Okay, we've not got into that place yet, but we'll get to that place. How you can choose, how you can research to know which hospital that's closest to you and reputable enough for you, suitable for you, that you would like to register with. That's where this healthcare provider, that's where you input that information and then you tap on submit. At the end of the day, the message that will pop up for you is that your application has been submitted. You will be called shortly. meaning NHIS staff or people there will call you to tell you what's the next step forward, and I'm very sure it will involve you having to visit their office. So personally, I just think that all you need to do is just to go straight down to their office and get it done straight up. And another drawback again for this online application, you might actually fill the form and submit it, and you wait for ages, nobody will call you. There's also that possibility. So I will enjoin you to just deal with a physical staff. You already have the contact details. I already shared it in the other video. You're going to check, the contacts for the office that you intend to visit. Just call, you know, and then visit the office and do what you have to do there. Next subtopic is how to pay NHIS enrollment fee slash NHIA ID card, or renewing NHIS subscription, or you want to add new dependents. How do you pay the fees for all of these? If you see here, I said allow staff do it for you. Why should you allow staff to do it for you? Like I said previously, you don't even know the exact amount you have to pay. You see that? So that's why you should allow staff to pay for you. But then, if you are very sure of the amount, or you have called the office you intend visiting and you have been told the amount to pay, then you can simply go on Remitter and make your payment. Whichever way, whether it is for fresh enrollment, whether it's for NHIA ID card, whether it's to renew your subscription, subsequently, or you want to add a new dependent, as much as you have confirmed the price, then you can go on to pay on remitter.net. All right, to pay for enrollment fee, NHIS enrollment fee, renewing subscription, and what have you, adding new dependents. These ones, they happen annually, because when you enroll, let's say today, you have to renew that subscription. So meaning you pay annually. But for your NHIA number, the ID card, that one is a one-time payment. I mean, when you pay the 1,500 naira as stated on the website, 1,500 naira, and you have your ID card, your NHIA number, there will be no need for you again to pay another money. I mean, NHIA number is NHIA number for life, just like that, just like you have your NIN. So it's as simple as that. But then you want to go on Remitter, say you are sure of the price, then you simply come to your Chrome browser and type remitter.net. And when it opens up for you on the home page, you simply scroll down to where you see, what is it here, bills and purchases. Purchases. This is it there. Bills and purchases. So we tap on that, we click that, it brings up options for us. The option you should choose there is pay billers. This one here. So now we tap on pay billers, it opens up for us another page. So let's wait for it. Then next thing is to start filling in the information that are required. It says, who do you want to pay? You want to pay the national, you type it, national health. As you are typing it, it will bring out the options for you. Health, see there, National Health Insurance Scheme, see there, it's already popping up for us. So tap on it, and then it says name of service slash purpose. Like, what do you want to pay for? Is it the enrollment fee? Is it the NHIA ID card? You need to renew your subscription. Is it to add a new dependent? Which one? What's the purpose? So tap on this arrow there. So from there you can choose whatever reason that you want to pay for. So now, so these are the add dependents here. Add dependent, extra dependent. You want to pay for any of that. That's the purpose. Then you tap on the little circle that's just in front of it there, and Then this part is NHIS identity card. That's where your NHI number is. When you have an identity card, your NHI number will be on it. So this is the option for that. Then gift ship contribution, that's the enrollment fee. Gift ship contribution, that's the enrollment fee. So even subsequently, when you want to renew your NHIS subscription, this is the option too. You will still choose gift ship contribution. So now, let's say we choose gift ship contribution, and then we put the description of what we want to pay for. So you come here, you type and say blah 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 blah, contribution or enrollment fee, gift ship enrollment fee for so and so persons, so and so number of persons. You write your names there and whatever description that would be needed there. Maybe your NHIA number. Just simply describe what you are paying for. Gift ship enrollment fee for 4 persons, for 3 persons, for 2 persons. Then put in the names there that you are paying for. Names that will match your NIN. Names that will match your NIN. So now you put in say you are sure of the amount to pay. You have done all the calculations. This is where you impute the amount to pay. After that, when you are done with that, you come and put in your name. The one who is paying, who is making the payment, put in your name there, your phone number, your email, and then tap on this I am not a robot box here. And then when that is done, you click on submit. When you click on submit, it takes you to a place where you can now input in your card details and then go on to make your payment and then print out your receipt of payments made. So that is that for that. So whichever one you want to do, you can simply come here, follow the steps that I've highlighted and do your payment. So okay, over to the next topic. Next subtopic is choosing or changing an NHIS hospital. How do you change your NHIS hospital, or how do you choose? Now, you have the right to choose or to select any participatory hospital or participating hospital of your choice at the point of registering for NHIS. So when you go over to the office, say you want to register, at that point there, you have a choice because they'll give you a form to fill. And I showed us just now on the online application part. So definitely that form that will be given to you to fill, we have a section for that. So you fill in the hospital that you desire. Say you know of a popular hospital around you, environment where you stay, where you live, and that's the one you would like to be under. You simply fill them in. But before you fill them in, you have to go confirm if they are participating. If those hospitals are hospitals under the NHIS. Very, very important. So now, how do you do that? How do you do that? So now you go over to the NHIA website. So let me show us. NHIA does suffer for our hand today. nhia.gov.ng. Okay, is loading. So you quickly, when you get to the home page, you scroll down as I'm scrolling down now. You can see different options here. one here, it says get enrolled. Next one says find healthcare provider. That's what we are looking for. Tap on find a healthcare provider. Here is a list. On this page, there is a list of hospitals that are participating nationwide. So it's a very, very long list. You see now it's still loading because the list is very long. So we'll wait for it to load. So now, this is the list of hospitals that are participating. You can see their healthcare provider code. You can see their healthcare provider name, their address, their facility type. So whichever. So how do you now navigate through? Do you just be scrolling and scrolling and scrolling to see which one you want? Remember I said that there is one that might be already in your mind. Maybe that you have seen in your area. All you just need to is come. So you see the search bar here. The search bar here. You come here and you do search of the hospital that you have in mind. You do search. So let's say I want. So yes, this is the search bar here, as I've already showed us before. So no need to show us again. I tap on it. It brings up option for me to type. So let's say I want Lily Clinic. Lily Clinic. So then I go over to the part where I can tap on search. This part here. There. So I tap on search. So this is it. It has brought out a result for us. So you see now, Lily Clinic / hospital. The address 6 Brisbane Street off Deco Road, Warri, Delta State. See that? There's also Lily Clinic in Lekki Ikate, Lekki in Lagos State. But the one I'm interested in is the one in Warri. So you see that? So let's say you do not have any clinic at all in mind. You can simply type in the place, the city where you live in, or the town where you live in. Say, let's say, for example, Warri. So I type Warri. I don't know why the site is hanging. So I type Warri and then hit the search button again. Then what will happen now is that the search results will bring out for us all the hospitals that are in Warri who are participating under the NHIS. You see Delta Clinic, which is in Sedco Road, NRN. This is which hospital is this one now? Estate Specialist Hospital in Onofegara Street. Yeah, I think that's what they want to spell here. Onofegara Street, Poloko Market, Warri. Victory Clinic, in Ginowa Road, Twins Clinic, Matan. So you can just be searching and looking around, the one that suits you, and then you just pick up the what's it called now? The details here, because you see healthcare provider name, Deco Specialist Clinic, and then there's a number attached to it. So that's, you pick out all of this information, pick out the address too, so that when you fill the form, you just lift this information there and put it on the form. Simple and easy for you. Also, you can choose to change hospital. So let's say you have done registration and you've started using the hospital for the NHIS, and along the way you do not like their service, their service is low, you don't like it, you can choose to change the hospital, but that will be done after 6 months of using the old hospital. So you must have used that hospital for at least 6 months before you can say you want to change, to another hospital. So what you need to do is to call your NHIS office or visit your NHIS office. They will give you a form for you to fill out, a change of provider form, and the change will be processed within some time with no fee attached. It is free to apply for change of hospital. But then you still have to go back to the website to check for a suitable hospital of your choice. So remember, the same way you chose an hospital when you were registering is the same way you can choose an hospital when you want to change. So just do your own research. I've showed us how to do it. Now over to the next topic. Over to the next topic is NHIS timelines and waiting period. NHIS has timelines and waiting periods, like a period of time where you have to wait for them to process your application. After registration, your application has a 90 days processing period for it to become effective. So you register today, you count 90 days from now before it will become effective. Before you can now start, raising your shoulder, 50-50 shoulder part, going to the hospital to say, hello, I have NHIS number, I'm registered, please, I need your service for so and so and so. you know. Number two, you can only apply for change of hospital after 6 months of using the said hospital. That's the timeline. Now, the next timeline here is 90 days processing period for adding or removing a dependent. You want to add a dependent or you want to remove a dependent, is 90 days it will take to process that form for you. There might be many other timelines, but for now, these are the 3 timelines that I have for you. Now, quickly over to the next subtopic is adding, removing, or replacing a dependent. You can apply to remove a dependent for free, providing documents for reason of removal. What could be those documents? Say, let's say death certificate, the person died, you want to remove the person. Divorce, you and your wife got divorced, or you and your husband got divorced, and you are the primary enrollee, and you are the one paying for it all this while. You can choose to apply to remove your husband, your former husband, or your ex-wife, whichever way, or any other thing at all that can serve as proof, reason for removal. And then you have to write a letter to the DG, the Director General of the NHIA. Now, next point is that you can add a new dependent, but you will pay enrollment fee, and submit the normal required documents just as you did when you first wanted to enroll. So the same fee applies, the same process applies, and then you can. Okay, before I go to this next point, I said the same fee applies, the same process applies, just as you want to do a new enrollment. Now, you can replace a removed dependent with another for free, since the new dependent will be taking over the slot of the old. Get that? So I think the only issue here will be the NHIA number. Because the NHIA number will already be having the name of the old dependent. So to change all of that, you might require a fee for that. But the normal enrollment fee, I think that the person who is being removed, if their subscription is still subsisting, the new dependent can take over that subscription. So that is that for that. Okay. How do you check your enrollment status? How do you check your enrollment status? with your NHIA number. I think I wanted to write your, then not you. With your NHIA number handy, simply call the office. You already have the number. Just call the office and say, "Bros, abeg, I wan check if my enrollment status don kickstart. If it has is now effective, if I can now go to the hospital and make use of my NHIS, subscription." So just call the office, or you send an email to info@nhia.gov.ng with your details, names and NHIA number. But I prefer you call the office, somebody you can talk with instantly there and then. I don't trust all these email stuff, all these Nigerian agencies and their email. They are mostly not responsive. So now, last words. What are my last words? Of course, you know my last words now. You know my last word. Buddy, oh yeah, all of this talk info that I've been giving you since. You are going to support me. Support me by subscribing to this channel and tell all your friends and family to subscribe too. Please, I beg you. Then share this video to as many that need the info. Please, 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 please subscribe to my channel and help the channel to grow. And for NHIS, una better come appoint me as una ambassador, so that I can be going everywhere and preaching the gospel of NHIS. You know that there will be a fee attached. No problem as I be charged fee. There will definitely be a fee attached. So NHIS, come and make me your ambassador, so that I will go everywhere proclaiming the NHIS and bringing new people on board for you guys. All right, with this we have come to the end of this video. Thank you very much for watching to the end. Bye bye.